Dr. Krishna Priya.
Good evening. My topic is a longitudinal study comparing severity of ocular staining score between patients with primary Sjogren's and other autoimmune diseases. Coming to the introduction, autoimmune diseases such as primary Sjogren's syndrome significantly impact ocular health, leading to dryness and discomfort due to decreased tear production. In a study conducted by Ramesh Kumar et al., prevalence of dry eye disease was 51% for rheumatoid, 31% for SLE, and 17% for Sjogren's. OSS, that is ocular staining score, is a crucial tool for assessing ocular surface integrity and quantifying damage to the cornea and conjunctiva. In another study conducted by Rasmussen et al., presence of one or more of the additional points for corneal staining pattern was highly predictive of Sjogren's syndrome, and it was associated with abnormal results of all measures of autoimmunity and glandular dysfunction. Understanding the differences in OSS can help tailor management strategies for patients with autoimmune diseases, improving their quality of life through targeted ocular therapies. Our aim of the study is to study the severity of dry eye among rheumatological conditions using OSS and to assess any exclusive staining pattern in Sjogren's syndrome. Our study was a longitudinal study done in a tertiary care center at Kollam of 1 year duration. And inclusion criteria include diagnosed cases of Sjogren's syndrome and other systemic autoimmune rheumatic diseases like rheumatoid, SLE, etc. Age group more than or equal to 16 years. Patients who have signed the informed consent to participate in the study, and exclusion criteria include past head and neck radiation treatment, known case of glaucoma on medications, patients who underwent corneal surgeries, contact lens wearers, physical or mental condition interfering with successful participation in the study. Our study methodology include consecutive patients who attended the rheumatology OPD and satisfying the inclusion criteria were given the speed questionnaire, and nature, frequency and severity of dry eye symptoms over the last 3 months were recorded. And patients with a score of at least 1 out of the 28 on the speed questionnaire underwent detailed ophthalmic evaluation, like they were subjected to visual acuity assessment, slit lamp examination, Schirmer 1 and 2, T-BUT and tear meniscus height. If Schirmer 1 less than or equal to less than 10 and Schirmer 2 less than 6 mm, patient was recorded to have aqueous tear deficiency. And if not satisfying these criteria and T-BUT is less than 10 seconds, patients was recorded to have evaporative dryness. And patients recorded with aqueous tear deficiency with or without evaporative dryness underwent this OSS, and it was done with fluorescein stain and lissamine green stain. And OSS was calculated according to the Sika ocular staining score, where a score of more than or equal to 5 suggests a positive OSS. And this is a Sika ocular staining score where grades are given according to the number of dots in cornea and conjunctiva, and extra points are given for if there is any patches of confluence staining in pupillary area, and if filaments are present, +1 each is given for the fluorescein only. And coming to the results, our sample size was 168 patients with a mean age of 50.21 years and a standard deviation of 13.36, and 50% belonged to 40 to 60 years, and majority of the patients were females. And coming to the profile of the rheumatological conditions, around 25% contributed by primary Sjogren's, and the rest 75.6% was contributed by non-Sjogren's, out of which 41% were diagnosed as rheumatoid. And around 42 patients had aqueous deficiency and 117 patients had evaporative dryness. And among the Sjogren's, 39% and non-Sjogren's 16.5% had aqueous deficiency. Coming to the analysis, the severity of aqueous deficient dry eyes was more among Sjogren's compared to non-Sjogren based on the Schirmer value. However, there was no statistical difference was seen in the OSS. Coming to the OSS scoring, around 89% patients had with Sjogren's syndrome had OSS more than or equal to 5, and around 87.5% among non-Sjogren's had OSS more than or equal to 5. And among the non-Sjogren's, rheumatoid, around 92% had OSS more than or equal to 5. These were the staining patterns obtained in our study population, and out of which confluence staining pattern was observed in around 37.5% Sjogren's and 9.5% non-Sjogren patients. And in our study, nasal staining pattern was mainly observed in Sjogren's patient. And coming to the discussion, dry eye, it is a major manifestation of Sjogren syndrome, and it is seen in other rheumatological conditions like rheumatoid, lupus, etc. And OSS, it is useful for assessing corneal and conjunctival damage in Sjogren syndrome. In our study, OSS score more than or equal to 5 was seen in 43% Sjogren's and 56.8% non-Sjogren's patients. And in a study conducted by Rasmussen et al., confluent staining pattern was seen in 11% patients positive with anti-SSA. And in our study population, confluent staining pattern was observed in 37.5% Sjogren's and 9.5% non-Sjogren's patients. And filament was observed only in a rheumatoid patient, and nasal staining was seen predominantly in 25% of Sjogren's patients. According to the Euler criteria of Sjogren's, a revised cutoff of 5 or more for OSS is used, and the scoring of the additional corneal fluorescein staining points, such as described in OSS, it increases the predictive value of the test. And in our study, since no statistically significant correlation was obtained, and the identification of corneal staining patterns, it was related to the antibody levels. Like confluent staining showed strongest association with positive anti-SSA, pupillary staining showed positive with strongest association with Schirmer's test, and filaments have positive correlation with anti-SSB and whole unstimulated salivary test result. This is our conclusion. Use of OSS is as a measure of keratoconjunctivitis sicca is in Sjogren's is valuable, and it is a predictive diagnostic and prognostic power in Sjogren's evaluation. In our study, severity of acute efficient dry eye was more among Sjogren's based on Schirmer 1 and 2, and no statistically significant difference between OSS was observed between Sjogren and non-Sjogren. And however, confluent staining pattern and nasal staining on OSS was seen predominantly in Sjogren's patient. And our limitations, it was a single observer study, and the sample size was small, and it could not correlate with antibody positivity and staining pattern in Sjogren syndrome. These are my references. Thank you.
Whether these patients were previously on any medication, anything difference? Oh, optical. No, not definitely. These patients are from the endometology OP.
Yes,
no, okay, definitely.
Some patients are using topical. Some new patients, we are starting out.
Did you notice any difference in this study on treated and non-treated?
Sir, on treatment, the patients are getting better.
Do you think that will influence any of your findings?
Sir,
Where was Rasmussen's study done? Which place?
sir, it outside India. According to American rheumatoid ACR